how are you going to take this home, the kind of experience you've just had, and how's it going to influence you, and just to have you guys as kind of, you know, experienced people in your field to share it with each other and come up with stuff and give us ideas. And so that's the idea. And so I want to kick it off by talking about me. Like, how do I think about it? How do I incorporate it? How do I integrate it into how I think about being a doctor or working in medicine and bringing it all together? So this is like this drawing that I made, and I'm going to explain it a little bit. And yeah, I mean, I'm kind of obsessed with the book, and I'm not trying to promote the book or anything. It's just, I'm just trying to say, like, this is my goal. My goal of the book was to tell this. For me, it's a textbook about this. The book is a textbook about this. And so then I use the story and I use the cases to illuminate this ultimately, something like this. And so, you know, just to kind of, as we try to integrate and come up with models and ways to discuss, you know, I'm going to go for the spirit first approach. Okay? For me, this is all the same. This is all the same thing. This is all the same thing. It's all the same. And on this side is kind of more of a very materialist, like the allopathic, the Western side, you know, these words that we throw around in the clinic, trauma, stress, like that's all welcome talk. You know, then I get into some of the details of that I got into in the book about research, and I'm just going to touch on it. It's not going to be so much about that, but I'm just going to talk about it for a moment. But in the psychology and neurology, endocrinology, immunology, all this kind of stuff, I'll just link that up. And these other aspects of the physiology that are related to trauma and emotional trauma and stress and that kind of energy. And on the other side, you know, maybe things we get a more metaphysical perspective. It's more of a metaphysical perspective. But, you know, for me, what I observe is that it's very arbitrary, like where we draw the line, what's metaphysical, what's not metaphysical. Like healing is kind of like, I guess that's open. You know, healing is kind of open, but therapy somehow is like considered more clinical, you know, to use the word therapy. So I was trying to look up what is the root etymology of therapy, and it means like to heal or to minister or to serve. Like that's the root of that word, therapy. Therapy is quite wide. I mean, it means healing, you know. So I mean, my point is that's so arbitrary to me that we say like psychotherapy, and then you can publish that in an academic study, but we say healing, and all of a sudden we're talking about something different. And that's really like the problem, you know, is that we just have this problem with the wholeness. So I'm just touching on this metaphysical to the material kind of thing, but I want to start like from the spiritual side. And so I'm just gonna just read a couple little quotes from the book I want to read to get into, and then I'm just gonna explain my drawing and move from there. So at the end of, because you know this has been, my integration has been all about, you know, what is the role of spiritual healing in modern healthcare? You know, this kind of healing that you guys are doing right now, what is the value to modern healthcare in the modern system, in the modern society? And then I have the Modern Spirit is our nonprofit that's geared towards demonstrating the value of spiritual healing in modern healthcare, showing people why is this important, why is this kind of healing important, how does it touch our lives, etc. So the first quote that the last chapter of the book is called "The Role of Spiritual Healing in Modern Healthcare." The first quote is from Sigmund Freud, who's, I guess, a psychologist, right? Or a psychiatrist. I don't know, is he a psychiatrist? See? Huh? There's a lot of... A psychiatrist? I hate to say that Alan is the last authority, but...
He's never a psychiatrist.
No one went after that. He has this from his book, a quote, talking about something he sent his friend. I had sent him, an unnamed friend, my small book, Future of Illusion, that treats religion as an illusion. And he answered that he entirely agreed with my judgment upon religion, but that he was very sorry, or he was sorry I had not properly appreciated the true source of religious sentiments. This, he says, consists in a peculiar feeling, which he himself is never without, which he finds confirmed by many others, and which he may suppose is present in millions of people. It is a feeling which he would like to call a sensation of, quote, eternity, a feeling of something limitless, unbounded, as it were, quote, oceanic. This feeling, he adds, is a purely subjective fact, not an article of faith. And then you have a quote from Sogyal Rinpoche from the Tibetan Book of Living and Dying. He says, and the path beyond the ordinary mind, all the great wisdom traditions have told us, is through the heart. And then there's just couple more lines I'm going to throw out there from the book. First is spiritual well-being. So if we're going to start at the spirit and try to understand spirit and how we can incorporate it and integrate it, spiritual well-being is reflected in emotional health. That's where it manifests in the being. So the emotional health, and then I said, well, there's this thing called the emotional body. The emotional body bridges the mind and body. And the heart is central to this whole apparatus, feeling, sensing, and interacting with mystical energies. Embodied consciousness exists within a larger mystery, beyond what our minds can understand. Paradoxically, access to this incomprehensible mystery is actually what allows us to make sense of things. Connection to the larger mystery gives us a sense of place and purpose in this life. This subjective connection to the boundless mystery, experienced through the emotional energy body, is what we traditionally describe as faith. So it's this idea of connection and actually the subjective fact, you know, like Sigmund Freud was talking to him about. Where is it again? It says this feeling he has is a purely subjective fact. It's not. He's saying it's not an article of faith. I'm saying that subjective fact is faith. And so we have the mind body. So this whole thing, to try to incorporate everything with like spirit, you know, spirit would be something that can go across the whole range. Okay, from the material to the metaphysical to the everything. Spirit. And then you have spirit localized within the lifespan. Okay, like what we call like our soul. In other words, it's part of us that's living through the lifespan, right? It's localized in space and time. So their spirit is infinite, and then here I am sitting in front of you, or whatever you experience, or whatever illusion that is to you. But it's like there's a part of me that's here, that's living this life. You know, that's born, is living right now, and will die. You know, that is like my lifespan, and that's kind of my soul's journey through this life. And then there's the part of me that's beyond all that, right? That's connected to everything beyond that. And people have had experiences like that, and people have had experiences, even last night, you know, there was a couple little wormholes that popped open. So that's that. Things that approach that from the traditional way, ways you can approach that holistic being, like mind, body, spirit, to completely open-ended mind, body, spirit, is, you know, it's a lot of what B has been touching on, is like these relationships. You know, these relationships to the cosmology, to the world in which we exist. So our relationship to nature, you know, this has been come up for Alan, for other people. Our relationship to practice, to spiritual practices that are going to open this channel of connection for us, and make this experience, this idea, make it a subjective fact, make it something that we feel, and we believe as much as other things that we feel. And then community, that our relationships to each other also open up this channel and this opening, and it provides a space for us to connect and feel connection. So there's this mind-body, the mind-body, which is, I kind of talk about how it's very much accepted within the Western paradigm. We can talk about mind-body, you know, at your universities, I think it's okay to say mind-body. It's kind of an accepted concept. So there's this mind-body. I think it was Eckhart Tolle, I quoted Eckhart Tolle, he said something like, you know, emotion is what bridges mind and body. So there's emotion. There's the mind-body, you know, which whatever that is, mind-body. But then there's emotion, too, that somehow involves a relationship with the body and the mind, and our experience of what it's like to be alive. And so we have this emotional part of ourselves, our emotional being, where we have an apparatus in our body, in our physical system, where we feel emotion, where in our bodies, through this system, we express emotion, our blushing, or whatever, our stomach rumbling, our tears, all this stuff that is actually like a real part of our physical apparatus. And we feel, you know, and we feel, not just inside of ourselves, but in response to our environment. And even in response to mystical energies, like what you guys experience, you know. You are sitting there, from the outside, you could just look at the person, they're just sitting there on a mat. Inside, their body's responding emotionally, dramatically, to mystical energies, you know, for lack of a better word. So there's an access that's open. The physiology is responding, no question. Okay, that's a real phenomenon. So this is the sensing of subtle energy. This is a subjective fact. This is something you feel, but in fact you can measure. You can measure the changes that the person is experiencing within their bodies. And it's because of this apparatus, the emotional body. So this emotional body, which has been talked about in Chinese medicine and Ayurveda and all that stuff, is, you know, one of the things I propose in the book is that we know what it is in the Western system. We know in the materialist, allopathic system, we know what the emotional body is. It's the network that's been described from all this mind-body research about stress and illness. It's the network that links our psychology and our emotional brain, our limbic brain, where like our amygdala is and the fear response and fight or flight and all that kind of stuff. How that's linked up from our brain to our nerves and our nervous system, the autonomic nervous system that controls, again, the way we express our emotions in our body, the way my face reacts to certain emotional events around me, the way my breathing is going to react to the way my heart rate is going to react to things that are happening or to energies that I see in the ayahuasca. So that, the nervous system, autonomic nervous system, with the sympathetic and parasympathetic drive, the endocrine system, the hormones, the way our hormones are going to respond, you know, like a more obvious example would be like adrenaline rush during the experience or cortisol fluctuations during such an experience. And then the immune system, okay, the way our white blood cells are going to respond. And let's say inflammatory levels are going to change. Maybe inflammation is going to go down, maybe inflammation is going to go up. So that's this system, that's the psychoneuroendocrine immunologic network that's been shown to be linked up. An example of an element of that system is the HPA axis, the hypothalamic pituitary axis, which is the stress response system of the body, which is known to be influenced by emotional trauma and stress. Like PTSD, you know, disturbs that system. So emotional, subtle energy, you know, it could be as obvious as war, it could be subtle from just some childhood neglect, but that has an influence on the system. And that physiology has changed. And now I'm just going to touch on this, that these are the material kind of facts around this kind of change. When you have emotional trauma that actually becomes real, these subjective facts of their personal experience, their life story, starts to track in things like what they call allostatic load, physiologic evidence of stress, wear, and tear on the body. Okay, inflammatory stuff starts kind of getting out of control, cortisol levels start getting screwed up, autonomic function, you know, with the blood pressure and the heart rate and all that stuff starts getting a little out of whack. Allostatic load. So you see this cortisol levels, autonomic nervous system, inflammation. And then we have further evidence now that the epigenetics, you know, gets affected. So this level close to the DNA is affected. So that's just this side, and I want to push more to that side. But that's just showing that this is a real thing that's very, you know, easily, it's being measured, and we're doing our research project with the MDMA PTSD study to track epigenetic changes in response to healing, you know. So we're way over there. These people are having a healing experience, and now we're going to look and see what changes over here, because it makes sense. This is all the same thing. So as we move to this side of the thing, in the middle of the apparatus is emotion in our heart. So that's this thing, Rinpoche is saying, this is the pathway beyond ordinary understanding, through the heart. And so this, when we want to try to understand how can we access the mystery, how can we feel this connection, how can we embrace or experience the subjective fact of these things that people have touched and felt the way this energy and these experiences and this love or whatever it is makes things happen in their body. It's through this emotional energy connection. Okay, so just like we have a mind-body pair, there's an emotion-energy pair. So through the emotional centers of the body, and it's as experienced by the emotional body that I'm describing here, this is a window and a portal to these energies that we feel and experience. And so this is through the heart. So we have the energy body as described by different traditions, like you know, Ayurveda or the, you know, the chakra system of that side, you know, the East Indian. So the chakra system, or the meridian systems of Chinese medicine, etc., or let's say systems described by the Shikibos, you know, like with this focus on the corona, this focus on the fingertips and things. And so there's this energy body. And so now all of a sudden, our access to this energy body and to the mystical is through this system. And so we have to go through the heart to experience these things. We have to heal and unclutter and unclog our energy body or our emotional body so that we can have more access to this. And this is what the people's call the person's blocked up. So you start the week and they don't open up to the ayahuasca. Yes, the people, oh, it's because they're blocked, you know. Watch this, we're gonna clean them. We're gonna clean them, watch. 2, 3 ceremonies, all of a sudden, they're gonna get access to something that they didn't have access to before. Because they needed to be cleansed. And a lot of that cleansing happens at an emotional level, but it's emotional energetic. It goes back and forth. When you heal people through things like this, let's say like PTSD, which would be healed like probably in a much longer process, much more careful process, and all the things, the care that we've been talking about around that. But you see PTSD where you know these things are all disturbed and they have all this research to study that. And you know their psychology is disturbed and their limbic brain is disturbed and their amygdala is disturbed and their autonomic nervous system is disturbed and their cortisol is disturbed and their inflammation is disturbed. You know it's a disease of the emotional body. So the shaman would say that's a spiritual illness. That's a spiritual illness. It's affecting all these elements. And so when we see this thing, we're saying, oh, as we clean and clear the person and we clean and clear the person, they have more access. As they find access to the mystical, which is the all-encompassing, ultimately, they start feeling a sense of purpose and a sense of meaning in their life. What they felt lost before, now this subjective fact, this connection, makes them feel like, oh my God, like, I think I know what I need to do. I think I know what my heart wants me to do. I think I know what I feel. You know, before it's cluttered, it's confused, or it's compartmentalized, all these different possibilities. And then it starts opening up. So then on the other side of it is that to approach this whole system, we're trying to clear up the person so they can open up to feel these things. So that portal, and that portal to the mystical through the emotional energy body, which is connected to this system, is, we're trying to open it up. And one way to approach it, you could just do things like this, like, change your cortisol levels with medications and alter things like that. Or you can do maybe, different forms of therapy or maybe let's say more like psychiatric drugs, on the more material side. But if you approach it this way, okay, let's say with ceremony, with ritual, with Icaro, so then now you can use that portal. You use that portal that was going from the heart and the emotions out to the mystical. Now you use the mystical to go in. And you heal the mind, body, and you heal this from the energetic side. And so that's the tradition. And so there's a thing, and the thing is about therapy and healing and all that, is that psychotherapy is the same actually. Psychotherapy is about doing this, okay? It's about reaching across the ether to the other person. And we're having this discussion with Monica and with a few other people that, some of the research has shown that really the only really distinguishing factor, some people believe, around really effective therapy is that they were a loving presence reflected back to the person. That was crucial. And so there's this concept that I pulled from this book, and I worked it into my theories from General Theory of Love, called Limbic Resonance. That this is a very mammalian biological reality that as I tune in to somebody else and I look in their eyes and I feel and we breathe together and we start doing just a mammal, like with a dog or with a baby, it's just a normal thing. I could just scan the room all the time. My instincts are telling me what people's emotions are for my own safety so they can see what I don't see, and we're just communal that way. We are communal that way. It's part of our nature, and we're constantly affected by the emotional states of those around us as expressed in their facial expressions or their tone of voice, etc., their breathing patterns. So we're constantly doing that. So when we tune in to somebody, and we call it limbic resonance. So then you tune in, I tune in, and then we start getting glimpses into each other's internal worlds. The same way that you can read your own facial expressions and get some information about that, you start getting it from the other person, and then something beyond that can happen as well. Your intuition, and you get an idea of what's going on in that person's world. The more you spend time with them, the more you connect, the more it becomes kind of telepathic. With your friend, you can look at them across the room and, you know what you're talking about with your brother, with your sister, etc. You have that. So this limbic resonance is this connection that allows people to emotionally attune to each other. So then that's the reflection of the loving presence. This person's telling their traumatic story, they're telling their traumatic story, going through trauma. The other person's reflecting loving presence, you know? So there's a contagious element to that starts to tune the other person to your emotional state. The same way agitated emotional states will start to agitate you, you know? And so that's this limbic regulation, is therapeutic limbic regulation that they describe, which is a lot of what therapy is doing. That is crossing the line between this emotional energy barrier. You know, there is something going on there that if we want to talk about it, you know, people write poems about it, people write songs about it. You know, it's a huge topic of like this energetic connection between two people sharing space with each other. You know, it's actually at the foundation, at the core of therapy. So that connection, this limbic resonance, involves two people's emotional bodies to tune into each other like this. Like this is the kind of tuning you can measure, like this is what's happening, you know, the way their heart rates are influencing each other and things like that. But at the energetic level, it opens a door. It opens a door. And so then when you have somebody on ayahuasca, and you open, and not necessarily the patient drinks, but let's say they do, they're opened up, you know, then the shaman, you train to sit with the person and tune in to them, you know. You train to clear yourself, so now you just try to see what's theirs. See, let their energy, the way your own energy tells you things about yourself, maybe flashes images in your head about, or maybe makes a dream, you know, from your day's activities. But now you're going to do that on somebody else. You're going to let their energy tell you and show you. And so then you see. And so now you use that connection, and then this energetic connection that you have in the imagination to start trying to alter what's going on here, you know, in the energy body. So that's Ikaro. That's shamanic healing. So you do that, you clear, you know, and it's weird because you start singing and you start clearing, and then sometimes from that, they throw up, you know. I didn't even touch them. We're just sitting here. I'm singing to them, and I was like, ah, you know. So it's like, it's this subjective fact. This is a phenomenon that occurs, that people train in this, and they study this, and this is something that we've now experienced. So that's that, you know, and so that's my thing. That's the whole system of how I think about it, and so you could show, that's what I'm trying to, you know, I wanted to study this in terms of this. I wanted to say, oh, can we show that we can heal people's epigenetics through ayahuasca shamanism? And that was a tough study to design, so then we decided to do the MDMA PTSD trial, and they agreed. MAPS agreed to let us track saliva and track epigenetics to show this connection. That's what I'm trying to show, you know? Because it's like, if you think, you know, you've seen it now, it's like, Ikaro, for example, can make you throw up. You know, ayahuasca is going to make you throw, but it's funny how the energies, it's something as real as that, as visceral as that. So that's the system, that's my form of integrating all this, and then, you know, other ways to approach this energy body and to create this healing that's going to blend that way are things like forgiveness, you know, which is a concept that has classically crossed psychotherapeutic, you know, that's always been welcome in psychotherapy, as well as the spiritual traditions, Catholic, etc., etc. You can talk about forgiveness, you know, but that is a spiritual concept traditionally for millennia. You know, that this is a heart energy thing that needs to happen. That just in your head, it doesn't do it. You have to go all the way into the depths of your heartfelt forgiveness. And that's the only way it's real. And anything less than that is not forgiveness. You know, it's just the talk. And so that's another one. Love, of course, self-love works that way. Gratitude is that way. Gratitude draws upon, some people believe, you're opening yourself to higher dimensional energies that then allow you to be nourished, you know, by the way you open yourself this way. You open your heart. You open your heart, compassion. You open your heart to yourself, you open your heart to others, and all of a sudden now you're connected to the world. Now you're enjoying and you're experiencing the world. So that's just some of my little theories that I wanted to throw at you guys. And that's the system. I don't know, hopefully. I don't know if you guys have any questions, and then we can move forward. Yeah.
Can you speak to the winds that are underneath the mind, ocean?
The wings is kind of inspired by the book cover. And so it's just, I was trying to balance out the composition of the drawing. And so I was doing little Shipibo designs, you know, the little Shipibo designs. Like you were having experiences with plant medicine designs. So a lot of times when I'm like starting out with my ayahuasca, I see the little, there's the full design, but then there's also the little highlights of the design that they highlight all the time. And sometimes I just see the highlights, you know, and I know I'm like starting to get the ayahuasca. And so then I like those highlights. So I just use them down here to try to just connect that to the energy for the art of it all. Yeah, anyone else? Is that enough? All right, I don't know what that was like for you guys, but for me it was really important.